Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. Today, we'll be discussing the basics of NHSN. Everyone has been entered into this meeting on mute, but if you have a question, you can put it into the chat or the Q&A, and we will discuss it at the end of this webinar. We encourage you to join us every Wednesday at 2 p.m. for more of our weekly webinars. Next week, we'll be discussing COVID-19 therapeutics in nursing homes. My name is Kathy Caudill. I'm a communication specialist with Quality Insights. And now I'd like to introduce our guest today, Deborah Wright. Deborah is a quality improvement specialist here at Quality Insights. She joined our team after being in the long-term care industry for more than 30 years. She has a wealth of experience in long-term care nursing and management, ranging from certified nursing assistant to vice president of healthcare operations. She is the most passionate when dealing with the MDS process and quality improvement. So Deborah, welcome and thank you for joining us again today.
Thanks, Kathy. So today I'm going to turn my screen off and I'm going to share a lot of screens, and I'm just going to do a disclaimer. Sometimes I get myself a little twisted in that. So Kathy's going to try to keep me on track here if you guys are not seeing what I'm seeing as I'm talking. But the hope today is to take the NHSN, like we said, back to the basics. We are starting to see with all of the staffing changes that facilities are enduring and having to overcome, that with that, you lose the chain of who has access to do your NHSN reporting. So we want to go back to the basics and make sure that you know how to assign a facility administrator for your NHSN account. And, you know, the wording of that sometimes gets facilities confused. It is not the administrator of the facility. It could be, but it's the administrator of your NHSN account. So how do you assign somebody to be that NHSN facility administrator? What happens if you change employment and you had NHSN access, but now you're going to another facility? How do you take that SAM access with you? How do you change your email address within NHSN and SAMs and basically continue as you've not lost your SAM access? You just need to change your email. We'll talk about how to add a user to NHSN and then assign those rights. And then we'll just open up the blank weekly modules that you have to do your reporting in, and just make sure that everyone has a clear understanding of what the definitions are, especially as it relates to what is considered up to date now. And talk about if there's been any changes, because now we're in a new quarter for the NHSN reporting. So with that, I am going to turn my computer or turn my video off and try to share some screens here with you.
And Deborah's going to be showing a few different web pages today. If you keep an eye on the chat, I will keep putting the links there in case anyone needs to access them. And for anyone watching a recording of this webinar later, I will include the links in the episode description and at our website, qualityinsights.org/QIN/multimedia.
All right, thanks, Kathy. So the first thing is, how do you assign that facility administrator for your NHSN account? So there are a couple different ways that you can do this. And the first one is to assign that facility administrator in your facility info tab. So once you've logged into NHSN, you will go down along the left-hand side, look for the facility tab, and then click on facility info. Once you do that, you will see at the bottom of your screen, there'll be two lines, contact information. It'll say facility administrator, and the other line that you can't see here will say the primary contact for your NHSN. Those definitely should be two different people for the most part, because that way, if you have staff that leave, you still have two people that would have been getting the information. So the facility administrator is the one, though, that is the most important when it comes to access to NHSN, because that is the only person that can change this role. So if the facility administrator, as we can see here, is T. McRae, leaves the building, nobody else can reassign that facility administrator without requesting special permission from NHSN. So if you know that the administrator is leaving, you want to have whoever was the administrator of the account, if they are leaving, you want to make sure that they reassign that before they leave, so that you don't have any delay in being able to reassign that. There is another way around that, but that is the primary way. Then you're going to save that information. And then what you want to do is that facility administrator of the account, once they have left, you want to deactivate them as a user. So you would do the same thing. You would find along the facility, and we're going to talk about this on other screenshot, but along the left-hand side, it will have users. And then you would enter either their user ID, or a lot of times what I find works best is putting their first and last name in, find them. Once they come up on the screen, then you would click the button that says deactivate, and that would make them no longer able to access your NHSN data. You can also, as an active user, you could check no for that. Now, the other way that you can identify a facility administrator for your NHSN account, you would have one person on that main facility info tab here. You would have one person listed as the facility administrator for your account. But also, as you are adding users, and they don't point this out, but I have tested this and I know that it works. If you, right here where it says user type, and on this screenshot it says other, you can choose facility administrator, and that will also allow that person access to change people's rights around in the system. And I'll show you another spot as we get to another screen, that there's other ways that you can make sure that somebody has all the rights. So I know in a building that I worked at in the past, we made sure that the administrator, the DON, ADON, the RNAC, if it was a small building and they helped with things, and the infection control nurse, they all had administrator rights, so that there was a large pool of people that could add users, change the facility administrator, and be able to do everything within the site. Maybe that person isn't the one that's doing your weekly reporting, but at least that person has access to go in and add or deactivate users and change their rights around. So is there any questions on the facility administrator before we go on? Okay, so then we are going to look at changing emails. So if you had SAM access, and I'm bringing it up here as I'm talking. If you had SAM access and now you are at a new building, or your facility has changed ownerships and your emails have changed, you want to make sure that in NHSN as well as SAM's, you update your email address. So if you are at the same building and you changed ownerships or your emails have changed, you can just go in and change those emails. If you have SAM access and you go to a different facility, your SAM access remains intact. You just need to change your contact information. You do not need to reapply for SAM access. So how you do that is, the first thing you want to do is you need to make sure, and I have had this happen in a building and it has created some issues. A lot of buildings still are using DON, ADON, NHAA, NHA at their designated facilities. That is not a unique email. So if in this instance they're using DON, if that DON was Susie Smith, and Susie Smith was attached to the email address DON at NHSN facility, and now Penny Imes is the DON, you are going to, Penny would have the same email, therefore it's not unique, and it's going to be, when you try to put that new person in with the same email address as somebody else, it's going to be rejected. So unfortunately, in these instances, either your company is going to have to give you a specific email for your organization, or you're going to have to use a personal email address or create an email that you would only use for this, that would be unique to just you. So the first thing you want to do is you need to go into SAMS to update your email address. That's the best option. Now, if you do NHSN first, it becomes a little bit more tricky, but you want to change it in SAMS first. So you're going to log into SAMS. You're going to use your SAM credentials. So it's showing you screenshots of logging into SAM. And then you're going to go to My Profile, and you're going to change My Email. So you're going to put in your current email, change your email, and then you can view your email to make sure that you've typed it correctly, because it doesn't ask you to type it in twice to make sure you didn't have any typos. Then once you do that, it does take about 48 hours for SAMS to process that request. And once they have processed it, they'll send you an email letting you know that it's been complete. Once that's complete, then you want to go into your NHSN under your specific facility, and then you will change your email address. And again, this is going to be, you may not be able to do that. If you were not given the rights when your user profile was set up, you may need to contact the administrator of NHSN to do that. But you would find yourself in the list, and here's where I was saying along the left-hand side, you would find users and then find, put in information and find, and then you would find yourself in the list, and this is where you would change your email. You would click on edit, and then you would update your email address to your email for the facility that you're now working at, or if your email has changed. So like they said, you need to make sure that your NHSN and your SAM access email matches before you try to do any more data submissions. And we talked about add user, but I will bring it up here on the screen just so you can see what it looks like. That's the next set here. So here's the information packet on how to add users. Again, on the left-hand side, you would find users, add, and then you have to create a user ID. However your facility does that. Sometimes it's just the person's name. Sometimes it's their employee ID, but I find using their name is easier when you try to find them in the list again. And then anything that has a red asterisk needs to be completed in order to save that individual as a new user. And then here's where the rights are. So you want to make sure that if they are going to be considered an administrator of the account, and again, this is not the facility administrator, this is the administrator of your NHSN account. This is where you could have multiple people. Like I said, you could have your NHA, DON, ADON, infection control nurse, RNAC. In one building, I made it the receptionist because it seemed to be the only position that wasn't turning over, and she was a constant. So she had administrator rights so that if when new staff came and old staff left, she could go in and add them as users and give them the rights that they needed. So you would give them all the rights, and then you would click save. Now, one thing you will see, trying to remember what screen it's on, not this one. Sorry if I'm making you dizzy here. You want to also do custom rights, and then there's additional boxes where you would check for, it would say staff, add, edit, delete, view, so that when you're doing that NHSN data, or if you're doing the Excel spreadsheet for your tracking of your immunizations, you would be able to not only see your residents, but also see the staff as well. So does anybody have any questions on setting up their NHSN access in the facilities? Okay, then the next couple of things we're going to do is just show you a blank form of the information that you're going to be inputting. And I find that these are helpful, especially when you have new staff, whether it's staff gathering the information or staff that are actually putting the information into NHSN, that they have a blank copy of the form before they go in to do their data entry into NHSN. They know what the questions are going to be, and if they have any questions, they can look it up in the table of contents and the user's manual, which Kathy is also putting the link in for that. So each form and each pathway that you're doing in NHSN does have a manual that goes with it that explains each question and gives you more information on how to complete that. But for the resident impact and facility capacity pathway, you're going to have your facility identifying information, dates for which the counts are reported. And I recommend that you do this for the same time period that you are doing your vaccinations. So that's typically Sunday to Monday. No, it's Monday to Sunday. So you have that same information. So you're reporting on the same days of the week for both reports. So you're just doing your census. Well, what's your licensed bed capacity? What's your current census? How many admissions did you have that were diagnosed with COVID and continue to require transmission-based precautions? How many new positive COVID tests have you had during the previous week? And then if you answer yes to positive tests, then that opens up the next section, and it wants to know what was their vaccination status, and how many booster doses, are they up to date, and all of that. And remember that if they had any vaccinations within the last 14 days of them testing positive, that you can't count that until those 14 days have gone by.
Hey Deb, are you currently supposed to be sharing your screen right now?
Yes.
Oh, sorry, we can't see your screen.
Okay.
We saw the add user, and we have not seen the resident impact and facility capacity.
Okay.
I'm sorry, I didn't interrupt. I thought that you were introducing it.
Oh, no. Can you see it now?
Yes, I can see it now. Thank you.
I don't know what happened. Okay. So again, here it is, your census, admissions, positive tests. If you've had a positive test, what's their vaccination status? And it even tells you right here, unless they've received a dose in the last 14 days, then you can't count any dose that was given in the last 14 days. And it asks the same questions as your vaccination report: not vaccinated, partially, completed the series, and if they've had any booster doses, and if they're up to date. And then it talks about deaths, COVID deaths, and this total deaths is for any reason. So if you have a resident that has been terminally ill and passes away, even if they did not have COVID, they're still tracking how many deaths did your facility incur during the past week. And then of those total deaths, how many had COVID or related complications. And then they're also influenza. It asks you if you're able to get your testing supplies, and if you have any urgent needs for any of your supplies or PPE shortages. Now, I have recently heard the testing availability that some facilities are getting a lot of testing supplies and some facilities are not. And I have nothing to base this on, but some of them believe that it's because with the new testing reporting requirements, that if you only have to report tests that were positive into NHSN under the POC testing, some facilities have chosen to continue to put all of their tests in there so that they can track them and be able to have a more easily traceable of when tests were done. Those facilities seem to be the ones that are saying they are getting an abundance of testing supplies. So my whole point to that is I do believe that there's testing supplies available. It's just a matter of whether they're coming to your building unsolicited, and we think that it's coming from if you are reporting even your negative tests into NHSN.
Yeah, we have a question here. It says, what is the COVID-related death based on? Cause of death on the death certificate? Is that what it's based on?
It does say if they have passed away from COVID-related complications. It does not say if it's on their death certificate. I do know of someone recently who passed away and had COVID. Not really sure that that was truly the cause of death, but the funeral home actually made the family go to the place where this person passed away at and make them correct, in their words, correct the death certificate to add COVID. So I do think, you know, again, it's subjective in a way, but I do think if they have had COVID and it's on the death certificate, that is what you would code. If it's not on the death certificate, I know when I was doing the reporting, I did not put it on there, but it's something that we can, let me look in the manual real quick here and see if it has clarified that any further. Just give me 1 second here. So COVID deaths who died from SARS-CoV-2 related complications and includes residents' deaths in the facility and in other locations, such as acute care facility in which the resident with COVID-19 was transferred to receive treatment. This count must include only new deaths since the last date counts for COVID-19 deaths were reported to NHSN. And then it just goes into that. So it does, it still is sticking to related complications related to SARS-CoV-2. So I would think that it would have to be in the death certificate. It does not specifically say that, but that's the definition. And then let's see here.
That's it for questions for right now. If anyone else has questions, please keep dropping those into the chat for us. And we can see your screen again, Deb.
Okay, so then this is the staff and personnel impact part. This is where you are doing the staff. If you've had any newly positive tests, any staff that have passed away due to COVID-19, how many staff have been positive for the flu, and then asks your questions about, do you have shortages of staff? So this is not where you're going to get that critical outreach if you need staff. This is just identifying, yes, we are short-staffed.
We have another question.
Okay.
It says, I have users that I'm struggling to get their security clearance.
So my first question would be if you've put them into NHSN, has that user received an email from NHSN or SAMS, and have they uploaded the documents that have been requested? Because sometimes we see the delay because they didn't do it that way and they're trying to get them access with not. So we are getting the email from SAMS. So I will have, Kathy, if you can put my email in the chat, and then what I could do is those that are having difficulty getting access, you can reach out to me and give me all the specific, as much information as you can, like when you added them as a user, if you have saved those emails, if you can send me copies of those emails, and maybe we can try to track and see where the breakdown is with that.
All right, I put the email in the chat, and for anyone who's called in, the email is dwight@qualityinsights.org. That's DWRIGHT@qualityinsights.org.
And I do know that we are almost out of time. So I just want to say that the next quarter of reporting, because we know NHSN, whether there's been changes in CDC's recommendations with what is considered up to date, what vaccines are due, what they're requiring. NHSN updates their reporting every quarter. The new quarter started December 26th. I have not seen that any changes have come out with those changes. However, we have been told, and I'm sure most of you have received email blasts on this, that at some point in January, the influenza tab for staff and residents will be going away. It's optional. And at this point, no one is collecting data from that. It's not mandatory for nursing homes, so they are removing those tabs for nursing homes. The other thing, as we pull up the blank vaccination summaries for residents and staff, is just to remind everybody what the definition of up to date means at this point in time. So this very simple version is up to date means that staff and residents have received the bivalent vaccination. The only other way that they would be considered up to date at this point in time, if they have not received the bivalent, is if they have completed their primary series less than 2 months ago. So the whole first booster, second booster, third, all of that has gone away. What is now required is your primary series, and 2 months later, the bivalent vaccine. So it's not like they had to have their 5th dose and then they get the bivalent. They get their primary series. 2 months later, they get their bivalent. At this point, nobody should be receiving a monovalent booster. So when, last month we were saying you're up to date if you've had your primary or any booster less than 2 months ago, you're considered up to date. Now it's simply your primary, 2 months later, the bivalent is what's considered up to date. So here's where I had said your week of data collection is Monday to Sunday. And you're going to say how many residents were staying in your facility for at least 1 day during that week. Of that, how many received a primary dose or just 1 dose, how many completed their primary series. Then you're going to say how many people wasn't medically contraindicated, offered but declined, and unknown. So then every number that you have in the boxes for 2 and 3 should equal the number that's in number 1. If not, then that you will get an error, because 2.1, 2.2, 3.1, 0.2, 0.3 should all equal the total number of residents staying in the facility. Then of the total number that completed their primary, so of the total number in 2.2, how many have received any additional booster doses? Then that number would equal 4.1 and 4.2. How many of the number in number 4 received only 1 booster dose, and how many received 2 or more booster doses? And then of that number in number 4, how many are considered up to date with the COVID-19 vaccine? So if you ever are in question as to what is up to date, they now have a link in there that can take you right to the most current definition of being up to date. And then the staff is basically the same. It looks like this. So here's the staff. You have the same data collection week, Monday to Sunday. And again, everything has to equal. So how many staff did you have working in your facility that were your employees, your licensed practitioners, trainees, volunteers, students, and your contract personnel, which would be in most cases your pharmacy, if you contract with the therapy, and your agency nursing. And then all the other questions are exactly the same. And this gets a little bit more tricky with making sure you don't get those errors, because you have to count all these boxes up to equal your total amount that's up here. So how many received one dose, completed their series, had medical contraindications, offered but declined, unknown, all of those numbers would equal the total numbers that are up here. And then again, how many received boosters, how many are considered up to date. And then Kathy is also going to drop in the chat, if you are a facility that uses the event level vaccination guide, or you upload CSV files, we will include those links of the most up-to-date guidance for that. So at this point, does anyone have any, I know that was a lot of information in a short period of time. Does anyone have any additional comments or questions regarding NHSN access, or questions in regards to what is considered up to date, or your data entry that you're doing?
All right, we'll take a couple minutes and wait for the rest of our questions to come in. Please use the chat or the Q&A tool, or if you would like to ask your question out loud, you can raise your hand and I will allow you to be able to unmute yourself and ask your question.
So I'm going I'm sorry, Kathy, I didn't mean to cut you off there. I'm going back to Rosalind's question because I'm actually reading it in the chat now. And it's just, she says she's struggling getting users their security clearance. Where was it? Because you're not getting email from Sam. So the first thing I would encourage you to do is to make sure that you have entered them as a new user in your NHSN account, because that is what prompts the email from NHSN to that new user. So if you've done that and the new user is still not getting their email and they've checked their spam and junk folder and they don't have the email from that, like I said, reach out to me and we can get on a call and I can try to help you work through some of that. Sorry, Kathy.
Sure, no problem. I was just going to go over some of next week's webinar and so on while everybody puts their questions in the chat. And then I think we'll wrap up in the next few minutes.
Okay.
So I'd like to remind everyone that next week's webinar will be discussing COVID-19 therapeutics, and that will be Wednesday at 2 p.m. again. And if you would like to talk further or have a one-on-one discussion, we also have office hours live chats twice a week. So that's another nice opportunity if you'd like to be able to talk about some of these issues. We have those every Tuesday at 8 a.m. and Thursday at 2 p.m. And we put the links to those live chats in the last minute lowdown. And that is our weekly newsletter that we send out on Fridays. So if you would like to receive that newsletter and you're not receiving it yet, you can email me at ccaudell@qualityinsights.org and I will get you on the list. And I will put my email in the chat again shortly for anyone who needs to be able to get in touch with me. And I will be emailing a recording for this webinar along with all these links to everyone who's registered for today's webinar on probably Thursday afternoon. So if you would like to have the links and the recording for this webinar, keep an eye on the email that you registered for with today, and I will be sending that out. Let's see. I don't see any other questions. Give it another minute. And again,
while we're doing that, I want to thank everyone and just stress that make sure that you have, you know, at least 2, 3, 4 people that have those administrative rights so that you don't lose the ability to gain access to do your weekly reporting, because as you can see with some facilities, it is still a challenge sometimes to get that access. It's not something that you just add a user and they instantly have access to do that. It is a process that you have to go through. I was talking to a facility this morning. I said it's almost like you're getting a passport, because you need to get that grid card to have your security access to go into SAMS and do your NHSN weekly reporting. So it does take time. So the sooner you can get people that SAM grid card and the ability to have facility administrator rights to add users and change their access, the better you will be for your facility, and you won't have any delays in reporting.
All right, well, I think we can wrap up for today. Again, if you have any follow-up questions, you can email Deborah at dbright@qualityinsights.org. Deborah, thank you for joining us again today. I'd like to thank you all for joining us today and hope to see you all back next week.
All right, thank you.
Thank you.